My name is Chloe. I'm a nurse practitioner student. I'll be doing your comprehensive exam today.
Okay.
Okay. Can you give me your full name
Angela Rose,
and your birthday?
2/27/91.
Do you know the month and the year that we're in right now?
It's July 2020.
Okay, great. And who is the president?
Donald Trump.
Could you go ahead and tell me how you would make a grocery list?
Yes, so I would look in my fridge, my cabinets, see what I'm missing, get a pen and paper, write those things down, and go to the store.
Okay, great. And do you have any suicidal ideation?
No.
Okay. I'm going to go ahead and assess your vital signs. So first we're going to do a blood pressure.
Okay.
Okay. Your blood pressure is 120/62, which is fine for someone your age. That's great. Now we're going to assess your pulse. So we will have done this for 1 full minute. So your pulse is 62, which is normal as well, and you have respirations going at 16. We'll also check your temperature, which is 98.2, which is fine as well. And do you have any pain today?
No.
No. Great. Okay. So now we're going to move on to the actual physical assessment. Do you mind if I touch you? First, we're going to assess your skin. We're going to assess for any lesions. Okay, the skin is warm and dry, and the texture is very smooth throughout. Okay? You have great skin turgor, means you're well hydrated. Do you have any edema or do you have any swelling in the feet or the hands?
No.
No. Okay, no edema is noted as well. Now I'm going to go ahead and palpate your scalp. Just bear with me as I feel around. Okay. I don't feel any lesions or bumps on the scalp. Your hair is full in texture. You have a lot of hair. There's no patterns of baldness noted on the scalp. Okay, now I'm going to assess your face for symmetry and your expressions. Do you have any acne or any problems with oily or dry skin?
No.
Great. So if you could go ahead and smile, you could frown. Okay, now you're going to close your eyes very tightly. Okay, now clench your teeth. Give me a smile. Great. So that will test for cranial nerves 5 and 8. So you could also puff your cheeks out for me as well. Great. Now I'm going to check for the sensation in the forehead and around the face. So I'm going to give you 2 sensations. It will be soft and sharp. If you could just differentiate between the 2 with your eyes closed.
Sure.
Okay, so just keep your eyes closed for me and tell me what you feel.
Sharp. Soft. Soft. Soft.
Great, so you got all of those correct. All right, now we're going to go ahead and feel for the temporal arteries. Okay, clench your teeth for me. Great. Okay. Now we're also going to check for the temporomandibular joint. So I just want to make sure there's no clicking like when you're chewing or when you're talking. So open and close your mouth. Great, so there's no clicking noted there. All right. Now we're going to assess the eye function. So that will be optic nerve number 2. To do that, we're going to use the Snellen chart. And for the sake of the exam, we'll just have you pretend to do the Snellen. So cover your right eye and just read line 3.
A, B, D, C, E, F.
And line 4.
1, 2, 3, C, E.
Okay, so we got 20/20 in that eye, in the left eye. And now you're going to do the opposite. And if you could read line 3 again.
A, B, D, C, F.
Okay, and line 4.
1, 2, 3, C, E.
Great, so 20/20 in both eyes, which is great, which is normal. Now we're going to test for the extraocular movement of the eyes. So you're going to go ahead and follow my finger with your eyes as I move along. Now focus on my finger as I move in closer. Great, so your ocular movement is fine. It's both symmetrical on both sides. Now I'm just going to use a pen light. So I'm going to assess the external eye as well as assess how your pupils constrict to light. So just look straight ahead if you want to focus on a point in the periphery. Great. So you have consensual constriction in both sides, so your pupils respond with the other one. Okay. Now we're going to go ahead and test the fundoscopic exam. So for this, I don't have an ophthalmoscope, so I'm just going to talk through it. So basically what we're going to do is I'm going to start about 10 inches away from you. I'm going to ask you again to focus on something ahead. Okay, I'm going to move in closer to you. I'm going to find the red reflex. Once I find that, I'm going to adjust the diopter to bring the optic fundus into focus. I'm going to assess for the optic disc the retinal vessels, the general background, and the macula. I would then do this on the other eye as well. All right, now we're gonna move on to the ears. So for this, I would need an otoscope, which I don't have, so I'm just going to talk through it once again. So I would lift the pinna up, I would insert the otoscope slightly, not too far in. I would assess for any cerumen or any excess drainage in the ear. Then I would assess for the tympanic membrane, making sure it was intact. It should be pearly gray in color. The cone of light should be at 5 o'clock on the right ear, and it should be at 7 o'clock on the left. So I would, again, do the same assessment onto the left ear. Now I'm gonna go ahead and test your hearing, okay? So that is cranial nerve number 8. So I'm gonna come behind you and I'm gonna whisper something. I would like you to repeat it out loud.
Sure. 5, 8, 10. 4, 6, 8.
Great, so that was great as well. Now I'm going to use a tuning fork, and we are going to do a test using that, so that will assess your conductive hearing. So I want you to tell me if you hear it differently on either ear, if it's louder in one ear or maybe less in the other ear.
It's the both. It's both.
It's equal on both sides? Great. All right. Next, I would use the otoscope to take a look inside the nose, so I would look in the nares. Okay, so I would look for any turbency or any the patency of the nares. Also looking at the mucosa, making sure it's pink and relatively moist. Okay, I'm also going to assess for cranial nerve number 1 by having you smell something.
Sure.
Just do me a favor and close your eyes. And I'm just going to put something under your nose if you could just smell it.
It's coffee.
Great, so you got that right as well. You could open your eyes. Now we're gonna go ahead and assess the mouth. All right, so the lips are pink in color. Stick your tongue out for me. Okay, you can relax. The soft and hard palate are both pink and moist. The uvula is intact. The tonsils are +1 grade, so they're not swollen or red. There's no exudate noted on the tonsils. Now if you could go ahead and move your tongue up and down. Okay, and then move it, poke both sides of your cheeks with your tongue. Okay, so tongue strength assesses for cranial nerves 9 and 10. And also by looking at the uvula, we can see how well that's functioning. I'm gonna ask you to move your neck up and down and side to side. Great, is there any trouble with range of motion with the neck?
No.
Okay, so on the neck, the skin seems good. There's no like striae or any acne. There's no scarring noted on the neck. So I'm going to palpate your lymph nodes now. I want you to tell me while I'm palpating if there's any tenderness noted. So first I'm going to start with the occipital at the base of the skull. I'll move forward to the posterior auricular behind the ear, the preauricular in front of the ear. Then I'll move along the submandibular, the submental, which is under the chin, go back to the jugulogastric, kind of where the jaw clicks. Then we move down the superficial cervical, the deep cervical, supraclavicular. We should definitely not be able to feel anything with the supraclavicular, and the posterior cervical along the back of the neck. Great. Did you have any tenderness with any of those? No. I couldn't palpate any lymph either, so everything looks good there. Now we're gonna just note the trachea and the thyroid gland. So I'm just gonna feel along your neck. And if you could go ahead and swallow for me. Great, everything feels fine there. Do you have any trouble with swallowing?
No.
No? All right, now we can assess your upper extremities. So I'm just gonna look, all right, I'm gonna find the preauricular lymph, I'm gonna palpate those. I would do that bilaterally. And then I'm gonna go ahead and ask you to kind of push your shoulders up against me. Okay, so that assesses for cranial nerve number 11. Now, I just want you to bend your joints up and down. I would feel on both sides. Now I'm gonna palpate the pulses in the arm. So first we're gonna start with the brachial, the radial, the ulnar. Okay, I would do the same on the other side, and they're all +2, so the pulses are all normal. All right. Now, if you could just move your wrists up and down, push against me. Okay, and push your fingers against me. Great. And grip both my hands. Great. So the strength is equal on both sides. Now I'm going to just go ahead and I'm going to test your reflexes. Okay. So leave your arm out for me. So we're going to check your brachioradialis. Okay, your radial. Great. We would then do that on the other side, and you have reflexes on both. All right. Now we're just going to do the same thing kind of we did with the face with the sensations. I'm going to do that on the upper arms. If you could just identify if it's soft or it's a sharp sensation. Close your eyes for me. Great.
Soft. Sharp. Sharp. Sharp.
Great. Okay. So now I want you to hold out your hand, and I'm going to put something in your hand, and I want you to identify what it is while closing your eyes.
Okay.
So keep your eyes closed, and you could feel it.
Say Q-tip.
Correct. Great. So we would then do that on the other side with something like a coin or something like that. Okay? I want you to hold out your hand as well with your eyes closed, and I'm going to draw a letter in your hand. I want you to tell me what letter it is.
T?
Correct. And we would then do that the same on the other side with another letter. Okay, I'm also going to assess for your capillary refill. Also noting the nail beds, the nail color. So you have your nails painted nicely, but it looks like the nail bed is nice and healthy. The capillary refill is less than 3 seconds on both sides. Okay. Now I'm going to assess the posterior and the lateral chest. So I want to look at your scapula first and the chest wall, so I'm going to observe how you're breathing.
Okay.
So the scapula, let's see, is equal on both sides. I'm just going to feel you as you breathe in. Take a nice deep breath in, breathe out, and one more. Great. Now I'm going to put my hands on your chest and I want you to say 99.
99.
Great. Again.
99.
Okay. There's no tactile fremitus noted either on the upper chest, on the upper posterior. Okay. Now I'm going to auscultate your breath sounds, so just take nice, even breaths. Please don't hyperventilate. Don't worry about me. I'll move along as you breathe. Great. Your breathing seems to be even and unlabored, and all the breath sounds are clear and vestibular. Okay. Now I'm going to percuss the intercostal spaces in the back. Okay. I'm also going to place my hand on the costovertebral angle, and I'm going to assess if you have tenderness. So I'm going to lightly tap my hand on top of your back. If you have any pain, I want you to let me know. Any pain with that one?
No.
We're going to do the same thing on the other side. Any pain with that one?
No.
No. Okay, next we would inspect the chest. Obviously we'll have you keep your shirt on, but normally we'd have the shirt off, as well as for that back assessment as well. Okay, so we're also going to see if you have any tactile fremitus. Take a nice deep breath. Okay, also say 99 for me.
99.
Great. Your chest expansion seems symmetrical bilaterally, and it seems normal to me. Okay. Now we're going to percuss the anterior chest wall. Great. Now we could go ahead and take a listen in the front. Breathe in. Okay, great. Now we could go ahead and we're going to listen to the heart sounds. So for this, I'm going to have you lay down. Just make yourself comfortable. So ideally, we would check for the JVD, and that would be at a 45-degree angle. So for the purpose, I'm just going to put your head on this pillow, so just lean up slightly. Okay. So then I would find kind of where the sternal border is, and I would measure. So yeah, so you don't have any excess distension. It's less than 3 centimeters. So you're gonna stay laying down for me, and I'm just going to listen to your heart sounds. Okay. We're gonna start with the tricuspid, the pulmonic, Erb's point, mitral. Okay, great. Now if you could move over and kind of lay slightly on your left side. Okay, I'm just going to feel for the apex of the heart. Okay, now you can continue to lay flat. I'm going to inspect your abdomen, so I'll leave your t-shirt on, but normally I would take a look. Okay, so first what we're gonna do is we're gonna auscultate the abdomen before we start touching it in any way. Great, so the bowel sounds are normal active in all 4 quadrants. While I have you in this position, I'm also going to auscultate for any vascular sounds, so your aortic, iliac, renal, and femoral arteries. Okay, and then we would move down more towards femoral, but I'll skip that for this exam. But normally we would do that. Okay? I'm also going to now percuss your abdomen. Okay, so there's generalized tympany over your entire abdomen. There's really not a lot of dullness. I would say that your liver span looks to me about 6 centimeters. Okay. Now I'm going to go ahead and I'm going to have you sit back up. Okay. So now we're just going to observe the legs and the feet. If you don't mind pulling your hands up a little bit. Okay, so there's equal hair distribution. There's no shininess. There's no like venous abnormalities or any arterial lesions or wounds. Okay. If you could go ahead and you're just going to push against me, so pull back, pull back. Do the same thing on the feet, push against me. Okay. The capillary on the refill on the toes looks good. The beds of the nail bed are healthy. Okay. So now I'm going to have you do a few tests to see how your strength is. So if you could go ahead and you can stand up. You're going to move your feet, like the back of your foot, to touch your shin. So heel to shin, heel to shin. Great. Okay, you can have a seat back now. I'm also going to test the sensation just like we had done on your face and your arms. So just tell me if you feel it soft or sharp while closing your eyes.
Sharp, soft, sharp, sharp.
Okay. Now I'm going to feel the lymph in the legs. So we would start with the femoral, then we would move on down, and we would go for the popliteal, the dorsalis pedis, and the posterior tibial. So we would do that on both sides. Now we're going to move along to see the strength of the hips, the joints, anything like that. So if you could just stand up for me once more. Just move the knee back and forth. Great, and back. Is there any pain with movement or anything like that?
No.
If you could kind of just roll your ankle as well. Great. And kind of lift your knee up so that it's kind of 90 degrees. Do you have any pain in your hip?
No.
No, you can relax. So we would do that on both sides. Now we're going to just attest for the reflexes, so I apologize, just sit down one more time.
Sure.
Okay. So we're going to do the patellar and the Achilles. So we do that on both sides. Now we're just going to lastly test for your range of motion as well as any spinal abnormalities. So stand up for me once more. Okay, you're gonna lean forward. Okay, I'm gonna feel along your spine. I don't know any scoliosis or anything like that. Now, could you walk back and forth for me? And back. Okay, if you could go ahead and just hop on one leg. Great, and the other. Now you're gonna walk back and forth, and I'd like you to place the heel in front of the toe as you walk. Great, that's good. Now I'm gonna have you do what's called the Romberg test. So you're gonna close your eyes. You could move your feet slightly a little bit more apart. And you're just going to stand still with your eyes closed for 20 seconds. I'll let you know when the 20 seconds is up. Great, that's good. So the Romberg test was negative for any abnormalities. Can you tell me the 3 questions I asked you in the beginning?
You asked me what my full name was, my date of birth, and what month and year it was, and who the president was.
Great. Do you have any questions for me?
Mm-mm.
No, great. Thanks for being part of my assessment.
Thank you.